Hello, my name is Dr. Joseph Feuerstein. I'm a gastroenterologist at Beth Israel Deaconess Medical Center in Boston, Massachusetts, Harvard Medical School. On behalf of my co-authors, Sarab Sethi, Elliot Tapper, Edward Belkin, Jeff Lewandowski, Anand Singla, Sunil Sheth, Mandeep Sawhney, it is my pleasure to discuss our manuscript titled Current Knowledge of Antibiotic Prophylaxis Guidelines Regarding GI Open Access Endoscopic Procedures is Inadequate. We first started to notice an issue with antibiotic prescribing prior to endoscopic procedures in our own practice. Open access endoscopy is an important tool that allows healthcare providers to refer their patients directly to endoscopic procedures without an initial gastroenterology consultation. The main reasoning behind open access endoscopy was to improve access to care and adherence to colon cancer screening guidelines. All too often we noticed that patients would arrive and inform us that they were told to always request antibiotics prior to any procedures. This request is often challenging given that the American Heart Association and the American Society for Gastrointestinal Endoscopy revised their guidelines in 2007 and 2008 to no longer recommend for routine antibiotic prophylaxis prior to endoscopic procedures with the goal to reduce the risk of bacterial endocarditis. Unfortunately, antibiotics, while they can be effective when used appropriately, they also carry the risk of side effects, complications like C. difficilitis, and development of drug resistance when used with just 1 or 2 doses. Given that patients have already been advised to request antibiotics, we decided that it would be important to develop a survey to assess what the current knowledge is regarding these guidelines. To avoid any individual institutional bias, we designed our study to include 3 academic medical centers with distinct patient populations and missions. We developed 10 theoretical patient scenarios based on the ASGE 2008 guidelines regarding antibiotic prophylaxis before endoscopy and the American Heart Association Prevention of Infective Endocarditis guidelines from 2007. We surveyed physicians in internal medicines and its subspecialties, as well as attendings and trainees. We were able to achieve an 80% response rate to our survey. The median correct answers to questions was 70%. There were no significant differences between medical centers or attendings and trainees. Gastroenterologists, however, were more likely to answer questions correctly compared to the other specialties. In multivariate analysis, we found that predictors of answering the questions correctly included self-reported familiarity with the guidelines, specialty, and interestingly, it was inversely associated with the year of medical school graduation. Overall, our survey indicates that the current knowledge of the societal guidelines regarding antibiotics before endoscopy is inadequate. Antibiotics are being inappropriately recommended prior to endoscopy, but the cause for this recommendation was not evaluated in our study. Further studies are necessary to assess what is the rate of antibiotic prophylaxis prior to endoscopy in clinical practice and what systems can be set up to prevent inappropriate antibiotic usage. Thank you very much for your time.